There have been so much of talk about healthcare bill that this is natural to get confused. Before even we try to find what is there in the bill, let's see the basic facts and why the insurance industry is so much against any reform. Fact number 1, insurance company do refuse coverage for pre-existing cases. Question is it fair? The answer may be yes or no. If we treat it totally as a business or business with moral values, but how we as a social and moral question, someone has to pay for this pre-existing sickness if the citizen cannot afford. I feel it is our moral obligation to cover the poor who cannot afford, so we need healthcare reform. Fact number 2, insurance company do drop people from insurance for chronic disease. The question arises, who is going to cover these sick people as moral society? We cannot dump these sick people anywhere. So we may have to have a health insurance that will cover these people. Fact number 3, we are not able to transport our insurance coverage from one job to another, or for that matter from one state to another state. So we do need insurance reform. Fact number 4, doctors and hospitals do charge too much and conduct too many tests that are not required so that they can make money and also to avoid lawsuits. So we do need healthcare reform to stop these people who overcharges and overprescribe for more money or simply to cover themselves against frivolous lawsuit. Fact number 5, the insurance industry is increasing premium 2 to 3 times than the inflation rate. Fact number 6, we need to limit the liabilities for the doctors and hospitals who are victims of frivolous lawsuit. Fact number 7, the drug companies are overcharging the price for the drug. So we need healthcare reform so that we can buy the prescription drug at a cheaper rate. Fact number 8, the insurance company have given over 11 million in contribution to the Congress people, to the senators and congressmen. These members will protect the insurance industry. The maximum money has gone to people like Senator Chuck Schumer from New York. So we need reform so that this money can be called back from these senators and Congress people and put it in a medical trust fund. Fact number 9, insurance industry is spreading lies with the help of some politician to frighten us. Lies like illegal immigrants are covered and many more. Fact number 10, do you know who are opposing this healthcare reform? It is the insurance industry CEO, number 1. Number 2, it is the member of Congress who have got hundreds and thousands of dollars in the contribution. Number 3, general public who are frightened and misinformed. And number 4, the media who is spreading lies or simply have been misinformed. So these are the 4 group of people: the media, the Congress, the insurance company executives, and misinformed people, those who are spreading the rumors and confusing us. Fact number 11, we talk about the country going into debt because of this insurance and healthcare reform. Well, have you heard of there is something called good debt and bad debt? So let me explain. Fact number 11, you must have heard something about bad debt and good debt. There are some debts which are good, there are some debts which are bad. Like we borrow the money and buy the house, take the mortgage, that is a good debt. We borrow the money and go and spend on vacation, that is a bad debt. For the healthcare industry and for the healthcare reform, it is a good debt. If at all we have to go into that, we can borrow the money, it will be a good debt. It will help the Medicare, Medicaid and our future generation going into bankruptcy and broke. So it will be a good debt for time being to borrow the money and take care of the health care reform rather than just putting it off for future generation. And the last one is fact number 12. We keep talking about the government-run healthcare industry. We are a democratic country. In democracy, it is the government by the people, for the people, of the people. So if we can have a government which has acted very responsibly and has been exemplary in controlling the fire department, the police department, the army, air force, navy, marine, if we can manage all those institutions so well, why can't we manage the health insurance and the health care itself? So it is a phony, it is a bogus idea that government means bad. No, if you want to say government means bad, then please go and look into the mirror. You are the government, you are the people, those who elect your representative. So if we are bad, our representative will be corrupt and we will have a bad government. So let's look into the mirror and let's elect good people who will represent us and do the right thing. So simply telling that government-run program is bad is not good enough. We are the people, let's have good government and let's have good government-run healthcare. Thank you.